I wanted to make a brief video about the brachial plexus, primarily for technologists who are doing MRIs. This is not my image. The copyright is here, but I'm just using it for teaching purposes. Here's the cervical spine, obviously the clavicle, the shoulder, and these lines that are coming down are the nerves of the brachial plexus. The brachial plexus goes from C5 through T1. So if this is C7, let's say, I guess maybe this is T1 in this case, T1, 7, 6, 5. So all this upper cervical spine stuff does not contribute to the cervical spine. Does not contribute to the brachial plexus. The way we image it, here is, we start off with a rectangular field of view coronal stir over both sides, and you can sort of see these faint, slightly bright lines coming through here. These are the nerves of the brachial plexus. They happen to go around or adjacent to the subclavian and axillary artery, which I'll show you in a second. But what I'd want you to show is we use a rectangular field of view, so we don't include the brain because that's not important. And even on this case where maybe this is, let's say this is T1, 7, 6, 5, there's even a little extra that's included that isn't necessary to include, but I understand it's sometimes difficult to do. Here's a coronal T1 where you can see the subclavian artery really well, and these little linear things that are nearby represent the brachial plexus. This is the subclavian vein, by the way. So really these lines, this is what we're looking for, and we're trying to follow them from the cervical spine to roughly here, roughly to the axilla. Okay. On sagittal images, we see it really well, actually. So here we're at the cervical spine. We come out, it's hard to see the exiting nerve roots very well on the T1, but as we get further along, you can see here's the subclavian artery, and these little dots around it represent the nerves of the brachial plexus, and here's the subclavian vein. So really we're looking at these structures. And one of the things that I would point out in terms of anterior to posterior coverage is if you look at where this is located, they kind of follow this plane. It's pretty much in a pretty narrow coronal plane. When we get I guess it's not going to make my cut lines, but basically sometimes we see people are getting coronal images that go then from skin surface to skin surface, and you can see it's a little bit of a waste because really what we're looking for is in a pretty narrow zone. If it helps to get higher resolution coronal images to narrow the anterior to posterior coverage of the coronal images, then one should do that. So sagittal is very important for anatomic definition. We see the nerves of the plexus with fat around them, helping to define where they are. We also get a sagittal stir where sometimes it's harder to see them, but sometimes you can see the nerves as they're coming out of the spine, these little bright dots. See those? As we follow them down, these are the nerves of the brachial plexus. And here we are basically at that same level as before. Here's the subclavian artery, and here are the nerves of the brachial plexus. And what we're looking for is there a mass along their course? Is their signal normal or abnormal? Now let me point out on this image also another problem. You see this band of noise? This is pulsation artifact from the heart and the great vessels. When you do these studies, you can put a saturation band on like the aortic arch, okay, the heart, if it's not already excluded, and maybe someone did put a sat band on the heart, but the arteries here, the aortic arch in particular, can cause problems. And what one can do is put a sat band diagonally like this because it's out of the way of the brachial plexus, right? We're following something here. If you were to make a band go like this, you could exclude all this stuff and maybe prevent the artifact from having a problem. Just one other thing I just want to show you just for interest's sake, I suppose, is we also look at the muscles. You can see the sort of edema in the rotator cuff muscles. This is a sign of a neuropathy and is helpful evidence to us and to the ordering doctors that there's something really going on, even when we don't see an abnormality in the plexus itself. Okay, I think that's long enough for this.